Hi, and today we're going to be doing a skill called transferring competency. And basically what transferring competency means is that we will study a client's dimension of their life where they've been successful, analyze that pattern of success, and then use those learned insights to apply them to the client's area of distress or the problem they're coming to see you for. So I'll give you an example of how to use this with a client. So client comes to you, they are referred by parole, they are been discharged from or released from incarceration recently, and they've been placed living with their family, their sister in this case. The client comes to you and they're having an incredibly difficult time. They're incredibly stressed living in their sister's house, very frustrated, very angry, and very upset. They can't stand the rules that their sister has. They can't stand all of the issues going on, the responsibilities that their sister's putting on them. That's their main distress today. And so we validate the client first, usually with a coping question. Again, how have you been coping with your sister? How have you been dealing with all of this stuff? And again, we use a coping question to slow the process down. And once the client is present, then we ask them a question and also give them a compliment. And this is how it's done. Now, the client was successful in completing incarceration, so we will ask them. Obviously, it's very difficult, for you to be at your sister's house. How the heck did you survive the 3.5 years you spent in state prison? How did you deal with that? There were people in gangs. There was violence. There were people getting, more time on their sentence for, the things that they got involved with. How did you successfully tolerate prison? And the client starts to smile a little bit, and their mind starts to change. Why? Because they've started to realize they did something. And now we're going to have a conversation about what the client did while they were in prison to make it out, to make that time not do them. And that whole concept of tolerating their sister's house, well, they understand what it is, to let the time, make sure that they do the time and not let the time do them. So then we repurpose that concept. We repurpose that experience. And I asked them, how can you start to practice this stuff in your sister's house? Well, I have to busy myself, the client says. I have to work out. I have to not focus on the stuff I can't control because it'll drive me nuts. What else do you have to do? I have to stay away from people that will get me into more trouble and try to busy myself and be quiet and keep to myself until that part is done. Well, can you do that right now? I would say. And the client says, yes, I most certainly can. This is going to be a lot easier than I thought. And by doing that simple exchange, what we've done is we've helped the client remember their resources. Remember they survived that time in prison, and they have all of those resources. Now they continue to think about how they've been victorious and how they can take that victory and apply it to the stress that they feel living with family right now. So again, simple, but can be profound for many clients because remember, a lot of us are not keeping track of what we do right. And if you're doing therapy with people, they should always, be able to keep in their mind what's their progress been, because whatever we focus on gets bigger. Thanks.